the opportunity that we have here today to come together. I would like to encourage you, if you're here and haven't seen any of our programs while you're on campus, please take a tour and look at everything that we have going, and we're excited. With that, I will turn the microphone over to Philip, and everybody have a great day. Thank you.
Thank you. Thank you, everyone, for coming to our first annual Healthcare Summit. Once again, thank you to Gadsden State Community College for being our host and our sponsor. Thank you also to McDonald's of Etowah County for providing us breakfast. And then thank you to our presenting sponsor, Align Technology and Insurance. And I wanted to introduce Ms. Heather New, the Vice President of Operations with Align Holdings, to introduce our moderator.
Good morning, everybody. I asked for the pleasure of introducing Kirby because I knew it would be really nervous, so I get say bye. So I'm going to give him some relief from that. Kirby Watson is president of Align Tech. Align Tech is based in Birmingham, but we have just recently, as of 2 months ago, acquired an additional location in Richmond. So as you can imagine, Kirby has been extremely busy with the integration of that acquisition. We very much appreciate him carving out some time to come and speak with you today. Kirby's got a lot of history in sales and marketing, but he has really become the guru of technology. And so I expect he's going to probably share a little bit of that knowledge and some of the questions he's going to ask today. So without further ado, please help me welcome Kirby Watson.
Thank you, Heather. I appreciate that. How's everybody doing this morning? Good. Got McDonald's breakfast. We're ready to learn and find out a little bit more about this Etowah Update Healthcare Initiative. So first, I'm going to introduce our esteemed panelist members. So first, we have Dean Joey Battle of Gadsden State Community College. Thank you for being here. We have Michael Hall, CEO of Gadsden Regional Medical Center. Will Tucker is the Assistant Director of Enrollment, Partnerships, and Marketing at Jacksonville State University. Then we have John Langlois, CEO of Riverview Regional Medical Center. And then last but not least, we have Dr. Justin Simon of the Alabama Cancer Care. So thank you for being here, Dr. All right, so you guys ready to jump in? Absolutely. Awesome. So this first question is going to be for Dean Jerry Bowles. Dean, as workforce needs all in Etowah County, what programs or partnerships is Gadsden State creating to align educational outcomes with the skills global employers are demanding?
Well, I guess the state has a number of partnerships that we're involved in. This could be medical centers, hospitals, doctors' offices, physician clinics. Each of these represents a programs that we currently offer here at Gadsden State. We do have advisory for minis. Most likely, it's going to occur at least annually for all of our programs, and that's ways we can solicit feedback from the community. We take that feedback and then try to integrate that into our curriculum. Back there are also afforded opportunities to go to national conferences. That's in that banner, they can bring back information nationally and try to integrate that into locally. Sometimes it's just current trends that may not have hit Gadsden yet, so we have to be that. Much of the curriculum that we have is a national curriculum, so sometimes it's hard to make changes, especially quickly, because it has to go through a pretty extensive process. But we do try to integrate any kind of new technologies and things like that as much as we can, and a lot of that is getting information back from advisory committees. Some of the current partnerships that we're doing in this area specifically, we have critical care EMS, we have tactical EMS, first responder training for our police departments. We got the EMS training for our fire departments. In surgical technology, we break out the curriculum, and with that, we're doing some short-term certificates to meet the needs of our constituents. And there we're looking at adding sterile cross system and your first assist.
Wow. Okay, that's fantastic. All right, next question is for Michael Hall. So, Michael, what are the biggest opportunities you see for Gadsden Regional to strengthen healthcare access and quality in Etowah County while contributing to economic growth?
So, there's two questions in there. How do we strengthen access, and then how do we help drives economic growth. So I'm going to address the elephant in the room. So on this front row, second row, I have 9 people. So between Gadsden Regional and Riverview, we only capture 60% of overall health care in Etowah County. So that means that first row, you all left our community to get your health care. We want to provide specialists. We want to provide great health care here close to home. We can only do that with the support of our community. We can't bring in, and John, I know will agree with me, I can't bring in a general surgeon if no one goes to him. We can't keep them here. They want to be busy. So when almost half of our community goes to Birmingham or other surrounding areas for their health care, that causes a strain upon our system. So if you want the easiest trigger for economic growth in Etowah County, stay here. Stay here, have your health care here. It will make a difference on the services that we are able to provide. You are right. We are never going to be a UAB. We'll never have all the capacities that they have as an academic medical center. But I promise you, both Riverview and Gadsden, we provide the same quality of care. We do open hearts. How neat is that? Right here in Etowah County. We can take care of 99% of your needs. You just have to come here. Now then we talk about how do we expand access. So again, as our population comes to our hospital, it allows us to bring in those additional specialists, to bring back neurosurgery, to grow cardiology, general surgery, GI, but also with technology going about and using telehealth. Right, that is a great thing that came out of COVID, is really using telehealth, especially for those underserved areas. We recognize it's hard for people sometimes to get away from work, especially when they're working an hourly job. They're the sole breadwinner for their family, and they're only making $9 an hour. For them to be able to step aside, step out into their car, step into a break room, and do a telehealth visit so they don't have to leave their job, what an impact that can have on expanding services in Etowah County, especially to the underserved. So we're always looking at telehealth, other ways to use technology. They now have wearables that we can use so that I can say, hey, we're going to go home, we're going to track, make sure that your blood sugar's in line, make sure that your weight's in line, blood pressure, and so that we can see you earlier. The last place we want to see you is in our hospital. Now, I want you to come, but the last place I want to see you is the hospital. I want to see you in the primary care clinics so that we're taking care of that before it gets there. I've seen a diabetic come into an emergency room and we've had to have the conversation saying, we have to take off your foot. That is a horrible conversation to have. I'd much rather have been able to say, you've been going to your primary care because of telehealth, remote wearables, other ways to get care through clinics that are located throughout Etowah County. We're going to take care of that before it even gets to that point. So I hope that answered the question.
Yeah.
But come to our hospitals, guys. That is the biggest thing that will drive economic growth and healthcare in Etowah County.
Thank you for that. All right, staying on the same topic, this next message is for Will Tucker. So, Will, what strategies is JSU employing to position itself as a key partner in economic development and workforce readiness for Etowah County?
For sure. So I want to preface as well by saying that I am serving in place today of our nursing faculty. So some of the answers and things that I give might not be as in depth as you would get from our nursing faculty. It is the first day of classes today. I reached out to everybody I possibly could. Hey, please, I'm not as well versed in this as you might be. So please bear with me with some of these answers because a lot of them are prepared directly from our faculty. So one thing I did get, so the undergraduate nursing program has adjusted admissions criteria to kind of meet that need. And we will have our largest cohort this fall since the pandemic. So that's something that we're really excited about. And on top of that, we're also looking into offering alternate pathways. So pathways for LPNs, pathways for RN to MSN, some kind of different. So we're not offering just traditional BSN to on top of that. So we can have a little bit more specialized programs, and it's not just you're coming here to get your traditional 4-year BSN and then move on. So we're looking to kind of broaden our pathways and broaden so we can capture a larger audience of student.
Fantastic. Thank you. All right, this next question is for Dr. Steinman. Dr. Steinman, how is Alabama Cancer Care expanding access to specialized cancer treatment in Etowah County, and what does that mean for local economic and health outcomes?
Great question. And in terms of expanding access to specialized care, we had spoken, or Mr. Hall had spoken about how, academic centers like UAB have all the bells and whistles, if you will. And what we can offer here in Etowah County is essentially the bells and whistles, but right here in your own community. We have access to state-of-the-art technology with image guidance radiotherapy, which includes stereotactic radiosurgery and stereotactic body radiotherapy, which allows us to treat brain metastases without having to go see a neurosurgeon. You can come in 3 treatments, have very, very precise beams of radiation that treat these brain mets as a bridge to getting your systemic therapy. With stereotactic body radiotherapy, we're moving towards having less number of treatments to have the same, if not better, curative outcomes. So historically with lung cancer, you're getting 30 treatments coming daily, Monday through Friday, with no treatments on the weekend. But with the SDRT that we offer, in 5 treatments, you're getting equal cure rates. Additionally, we have state-of-the-art diagnostics with our PET CT and working with low-dose CT to allow for early screening and detection of lung cancer so that you don't need to get chemotherapy, because the outcomes are much worse if it's detected late and it's in the lymph nodes. So we're kind of trying to make sure that we're staying on top of everything with precision oncology as well to target each patient's cancer individually, because all breast cancers are not the same. All lung cancers are not the same. So we have these updated screening tests and molecular tests like next generation sequencing, which can isolate the tumor at the molecular level to see what mutations are driving that tumor. We have standards of care that we employ in terms of first-line chemotherapy, but if God forbid the cancer were to progress, we have a molecular roadmap to this patient's cancer, so we don't need to guess at what the most effective targeted therapy is going to be. And in terms of health outcomes, what this is going to do with early detection is going to lead to higher cure rates. It's going to improve the quality of the patient's life and get them back to work quicker so that they can support their families and make it so that they don't have to rely on, public support programs and things like that. And furthermore, just decrease the outmigration of care, because as you had said, keeping care within Etowah County is what we're going to do. That's going to stimulate growth of the county. It's going to stimulate economic growth. And, it's better on the patient because they don't want to incur all these extra costs having to drive to Birmingham, figure out a lodging situation. So to have one-stop shop in our facility where you can get chemotherapy, radiation therapy, diagnostic imaging, as well as support for other non-oncologic entities like autoimmune diseases, arthritis, Alzheimer's. We're really trying to make it a full circle care where you can come here and know that you may not have cancer, but we still have something for you.
Thank you. All right, last but definitely not least, John, from your perspective as CEO, what are the most significant operational and workforce challenges hospitals in Etowah County face today?
Hospitals all over the country are facing significant workforce and patient care challenges. These issues are exacerbated by aging population and more complexity of patient needs. Some of the workforce challenges specifically are staffing shortages. It's due to an aging workforce and high turnover. We have burnout and turnover, which is due to high stress, long hours, which can impact morale and ultimately compromise patient care. Lack of critical skills. Specific skills for complex patient needs are lacking. Financial pressures. If you unused contract labor, it tends to lead to more with less because there's only so many dollars. And Alabama was in a shrinking reimbursement, but we're still fighting the same inflation. Regulatory and AI challenges. They're time consuming, and while AI is going to be the wave of the future, it also adds stress. Some of the patient care challenges that we're facing: decreased patient interaction time, just primarily from staff shortages, inadequate staffing, which can lead to long wait times, potential increased errors, technological overload, overwhelming and can create inefficiencies, addressing health inequities, socioeconomic barriers, access issues, and systematic inequities. And finally, the increasing mental health crisis, which the state of Alabama has very limited resources to address. Some of the mitigation strategies that we're trying to focus on is focus on retention and recruitment. You know, pay, of course, is important, but also a good work-life balance. Jess, my son-in-law right there, has done a really good job of trying to create flexible schedules and try to address these needs, and it's coming down. Reducing burnout, providing the mental health services, and fostering a positive work environment. Streamline workflows. Invest in training and education. That's all time consuming, but it can lead to increased efficiencies. As was mentioned earlier, promote telehealth. A nurse can see a lot more through telehealth and not face some of the burnout. And then finally, addressing some of the health inequities, which transportation and language barriers is a big issue here.
Thank you. So that wraps up our kind of economic growth topic. I think one thing that is common throughout several of your responses is keep care in Etowah County. I think that's the overarching message here. So that's super important. It continues to drive everything we do. So thank you for that. All right, and on to this next topic, which is personally my favorite topic, which is technology. So we're going to get a little in-depth into how you guys are embracing technology to organizations. So this first question is going to be for Deep Battles. How is technology influencing the way Gadsden City delivers education and training, particularly for healthcare-related programs?
Well, actually, there's been two recent changes that we've really embraced: artificial intelligence and virtual reality. And I'll talk about artificial intelligence first. I was giving this really great example recently, and I'm going to reuse it. But when I was in grammar school, we were not allowed to use calculators at all. And what I've heard all the time was, you won't have a calculator with you all the time. I now have two with me all the time. I don't even have to touch them. I mean, I can just ask them, an equation, a question, what's 37 degrees Celsius into Fahrenheit? I mean, they can do all these calculations for me. So we've got to embrace artificial intelligence. And to be honest, we've done that really well in health sciences. What we've got to do is teach students how to use it the correct way. Already, in just a short amount of time, if you've used, ChatGPT, it has saved me hours and hours of time. Now I have to go back and check what it sends out to make sure that that's correct, and I have to do some alterations, but it's pretty good. So we've got to embrace artificial intelligence and how we could integrate it into our programs. The other thing is VR, virtual reality. We just talked about grants coming up. It's heard we got about $1 million grants, which sounds fantastic, and it is fantastic, and we're so thankful. $1 million in health sciences is a drop in the bucket. It really is a drop in the bucket. We have a mannequin upstairs. It's $140,000. Have X-ray equipment that's about 2 times that amount. And so when we're looking at labs and disposables, an IV catheter for us is $2. The arm that we use to do IV practice on is $700. And really, when we're getting about 60 or 70 students going through, you get 1 semester with that arm. And it's ruined. It's completely ruined. So labs are very, very expensive. And, when you're wanting venipuncture and you're going to be doing venipuncture on me, I want you to practice multiple times. Multiple times. I want you to be really good at it. So we want our students to be really good at it. So we got to find alternative ways of having students to practice this. And VR is the way of doing it. So we just need it to come forward just a little bit. We need the people that's inside it to look like real people, similar to like an Xbox or something like that. And it's getting there. And so we are already making strides. Our surgical technology programs is a good example. We're revamping that space. We've already put a space in for a VR setup. So as soon as the technology sort of gets a little bit better, we're going to be ready for it. But again, it's going to help to keep our lab costs down. Our students right now are very lucky. They pay $25 per year for all of their lab costs. That's you just don't hear that. That's 6 catheters essentially, and a few other things. So we do take up the cost for a lot of those things, but at some point we've got to find alternative methods to do fast. So VR is going to be the way.
And the next step is augmented reality.
Yes.
That's nice. Society. That's great. Okay. Next up for Michael, how is Gadsden Regional Medical Center integrating technology such as telehealth, AI diagnostics, or patient engagement tools into service delivery today?
I kind of already touched on it a little bit. With telehealth, again, we have it for primary care. Even if we don't need it very much in the hospital, but if there's a specialist that we don't have, we can get them on our phone. We can get them on a virtual monitor where they're actually able to we're able to put a stethoscope on the patient, and the doctor, thousands of miles away, hundreds of miles away, can actually hear their heartbeat and help do that diagnosis. We have virtual sitters. So you have patients that will come in that are confused, that, I have dementia or due to whatever the acute condition is, just are not following the instructions as well as we would like. And we don't want them to fall. The last thing we ever want someone to do in a hospital is fall and get injured more. And so we're able to actually it's called the Avisure system. You put a camera in their room, and there's someone on the other end that can watch multiple cameras. And if someone starts to get up out of bed, say, hey, will you please sit down? We want you to sit down. We want you to be safe. And then notify our nursing staff. So there's a lot of great things. You know what? Most of you have patient portals on your phones. You're able to go in, you see your lab results sooner than your docs. Your docs actually hate that because you'll start Googling it first. We have a lot of things that are out there. We're always exploring more. Healthcare, I wish we adapted it a little bit faster, but at the same time, there's always those concerns that we have with technology about keeping your data safe. We recognize how private and personal healthcare information is for the patient. So we want to make sure that anything we do is making sure that all of the protections are in place so that your information is secure. But again, we are constantly looking at other tools and are excited to see what the future brings.
Fantastic. All right. Will, how is technology transforming the way JSU engages, recruits, and supports students pursuing healthcare careers?
So I think it plays into what the gentleman said too, like Dean Battle said, when you got the phone everywhere you go, and it is our central hub for really how we process everything, for how we see our life right now. So the one thing that we've really tried to do is utilize social media marketing a lot. I'm sure that if you've Googled anything JSU, like or Jack State, if you go on there and Google degrees Jack State, nursing Jack State, you're then going to start seeing some ads after that. That's, like, hey, come check out our BSN program, come tour. Like, you're going to see those things auto-populate in there because we have these running ads like that. So that's something that we're trying to utilize more and more. On top of that, we're trying to kind of broaden our distance learning, because if there's anything that I found that being in higher education is that, students more and more since COVID I want to learn online. I don't necessarily need to go to campus. I don't need to see you. I want to be able to do everything from my laptop. I want to be able to learn these classes and, pass the exam I need to do. So we're trying to broaden those. One thing that we're excited about is the RN to BSN program that we have. It's the STEP program that students can jump directly from their associate degree here into the BSN program and be done in 4 semesters. So they can be done in just about a year, or 3 semesters, sorry. So that's something that we're trying to offer. And as the same, like, technology is ever adapting and ever growing. So we're always looking at different options, and we're trying to keep up with the times.
All right, Dr. Simon, what role does technology from advanced imaging to data-driven treatment planning play in your patient care strategy?
So I love talking about technology in my field. As a radiation oncology, technology pretty much the basis of everything that I do. And over decades of time, radiation oncology has evolved with the improvement in diagnostic technology. So with our in-house diagnostics, PET-CT, PSMA PET scan, we're working towards getting brain PETs for Alzheimer's. We're getting the most modern imaging studies that we can, which can allow us to, detect the tumors earlier and use it for fusion for treatment planning. Because with our linear accelerator and our treatment planning system, The goal of that is to minimize normal tissue toxicity and maximize tumor control in our target volumes. So we're able to take our PET scans and fuse them with our cloning scans to make sure that the margins are as small as possible to still maximize tumor control and spare the dose to the normal organs. Because yes, you have cancer, but we want to make sure that by curing your cancer, we're not also giving you lung disease, heart disease. So the ability to do that, and AI utilizing that for auto contouring to just automatically put on the contours of the lung, the heart, the small bowel, the spinal cord, which of course you still have to check because it's AI, but it just saves a tremendous amount of time, which allows the patient to get in the door and to treatment much faster, because things that would have normally taken hours to days, we can do in minutes and crank out a plan so that I see you for your cancer on Tuesday and we start your treatment the following Monday. So it's really improved in terms of the speed and the efficacy of what we can do. And again, as I said, with stereotactic treatments, the ability to utilize high dose radiation with smaller margins to ablate the tumor but spare all the normal tissue, you can't trade anything for that. And the ability to do that in 3 to 5 treatments just makes it more convenient on the patient. Now, in terms of data-driven stuff, we're constantly looking at international clinical trials and standards of care and how they're changing based on real-time data. We're able to use new technologies like circulating tumor DNA assays to make sure that we're detecting recurrences before you can see them clinically or radiographically. And I already touched on that next generation sequencing. But with the improvements in genetic testing, if you meet criteria, we can get genetic testing on you, which one could influence the treatment pathway that you go down, but more importantly, impact the screenings for your future offsprings and for future generations by getting ahead of things, saying, okay, you have this driver mutation that was likely responsible for your cancer. Your children are at risk for this, so let's get them in for early screening. So the advancement in oncology has just been tremendous, and it's something that I'm excited about and always look forward to the next publication to look and see, hey, what can we be doing better? Because, nobody's perfect. And if we're not perfect for cancer treatments, then we're not doing everything that we can do. So there's always room for improvement.
Very well said. So, John, how is technology from electronic health records to telehealth and data analytics transforming the way Riverview delivers care and also manages resources?
Okay. Technology like EHRs, they've been around for a while now. And remote patient monitoring are significantly changing the way nursing care is delivered. It improves data management, communication, patient monitoring, ultimately leading to better outcomes and more efficient workflows. EHRs have pretty much replaced paper charts. And what this does, it allows the nurses to improve data accuracy and accessibility. It streamlines the documentation. It's enhanced communication between departments. It's data driven. We can see trends. It's easier to monitor transcripts because it's real time. And it also has decision support tools at your fingertips. We use Epic in our hospital as well as all our employee clinics. And it really is a huge time saver. It really is better for the patients. In terms of remote patient monitoring, this allows the nurses to track vital signs, monitor chronic conditions, which we have a major problem with in the county, and detect early warning signs of health problems. This ultimately leads to improved patient outcomes. We can manage chronic conditions. We can detect the issues so much earlier. It also improves patient engagement. Patients tend to track their own data and have more interface with our providers. It also delivers more efficient care, and ultimately, as was stated earlier, it keeps people out of the hospital. It generates a cost savings. Like I said, we want the patients, but we would rather you get treated at home and get better before it gets to the point where you need the high dollar care.
Thank you. All right, so that would be the technology topic. Sounds like everyone is embracing the changes. Everything, technology is evolving every single day. AI is a big piece of that. I think you made the comment, trust a verified AI. That's super important when you're dealing with those GPTs. So that's fantastic to hear you guys, right? All right, next up, this topic is going to be based on risk, something we always have to be very cautious of. And I just want to put this out there. So For Dean Battles, what risks do you see emerging in higher education, whether from enrollment trends, funding changes, digital transformation, and how are you addressing?
Three major changes or issues that we're having to look at. One is filling vacuum positions. Obviously, is our nursing, since we're in the nursing building, or the nursing auditorium, rather. I have 6 nurse practitioners on staff. So half of the teaching faculty are advanced practice nurses, which could make 2 to 2.5 times what they're making here. And so being a retaining faculty that's could be potentially pulled out for higher pays is difficult. We now have to compete with K-12. K-12 salaries now, especially in our academic area, is pulling faculty away from the community colleges back to K-12. So filling those positions continues to be a concern. I'm very lucky here that we are completely filled, but that could change at any time. Increased tuition is always an issue for students. We're very lucky. My last institution, I just looked this morning, their tuition is $700 a credit hour. We're very lucky here. We went up slightly this year, $192 a credit hour. So it's very affordable for students to come here. But again, federal monies for grants and things like that continue to decrease. And so, just making sure the students can afford. We lost probably about a dozen students this fall semester alone, just in chemical funding. And this simply did not have the funding, which is very heartbreaking. And again, I think the effects of COVID, we probably have all seen this. For 2 years, there was somebody on the news every single night that was talking about, how hard it was. And it was hard. It was. I'm not downplaying that, but, we're growing up and seeing, a nurse say, I saw 6 people die. No one should see 6 people die in their career, let alone 6 people die in one day. And so I think healthcare has sort of come out of favor. And so we're starting to see the trends change a little bit now. Students' interest in healthcare is returning, but it's been a slow process. We have not filled a couple of our programs to capacity. And so continues to be a challenge for us. How do we make it so that students want to come back in? We try to do this with some information sessions and it's still, one thing I always hated, when you were interviewing and they would ask you a question of, why don't you get into healthcare? Like, oh, don't say help people. And I thought that is the only reason I got it. Was to help people. I'm like, why is that a bad answer? I never forget that. I thought that is the best answer. That's really the only answer I really want to hear, to be honest with you. But just really trying to get students to see that, or potential students, that it is a great profession. I've done this for over 30-something years. I have not had one day in my career that I've been like, I don't like this. I still love it. I still love it. So I plug in here with a cane. Enjoy this. So I hope that we can promote more students to get into healthcare, but it's a challenge.
Mike, what are the most significant risks facing hospitals today, from cybersecurity threats, staffing shortages, and how are you mitigating? Well,
Both of those are two of the biggest. I've been in a hospital where we were hit with a ransom attack. We were down for 2 weeks. It's not fun. The thing, though, in healthcare is we are always planning. We are always looking to mitigate potentials. So we have downtime procedures. We have procedures in place so that if we lose all ability to technology, we can still function and that we can still take care of our patients. Yes, we may not do as many elective surgeries that week, but we took care of every single patient we had. We didn't have to transfer anyone out. That was not here in Gadsden. It was at a different hospital. But we always are doing things to make sure that we can mitigate it. When staff is shortages, absolutely, 100%. So what do? We cross-train. We say, how can I help cross-train so that when we have holes, when we have gaps, we can have people that we can slot into those things, that we can be ready. One of the biggest issues right now, I think, facing healthcare across the nation is payers. We have Medicare Advantage plans. They do a great job advertising. They do an absolutely wonderful job advertising, and they never pay us. So healthcare is unique, right? You walk into Walmart, you say, I want a loaf of bread. They're going to say, hey, it's $2. If you don't have the $2, guess what? You're walking out without that loaf of bread. You walk into healthcare and you say, hey, my appendix, I think it's about to burst. Guess what? We're taking that appendix out, regardless of your ability to pay. So when we have payers that we provide services to their enrollees, to you, and we're not able to get reimbursed for it, to help us strain on all of the system. We talked about staffing shortages. You're right. I'd love it if every nurse said, I'm here because I want to help people. Some of them are there, though, because they want to make money. Guess what? I don't get paid. I can't give raises. That's a strain. So it's always for us constantly looking, how do we make sure that we are the most efficient, we operate the most, we work with our governments, with legislatures to try to make sure that our payers are paying us. But again, I think for us in healthcare, we recognize that it is vital that we always have a backup plan. And so we are always planning. Every single day we're running drills, planning what if.
Private planning is important. Will, what risks do you see to enrolling pipelines for healthcare and other critical workforce programs? And how is GSU adopting?
For sure. So I kind of see it as three different segments. It would be like funding, retention, and availability. And when I say that, so funding, I couldn't agree with Dean Battles more, and that is a huge hurdle that we see with students of like, want to continue on my education, but I don't know if I can afford it. I don't know. Maybe the associate's degree is where I need to end, and I don't need to get my bachelor's degree. So something that we're really excited about is that we have these business partnerships, and this is a large one that we have with the Etowah County Chamber of Commerce, as well as various different hospitals and local businesses, that we offer a 20% tuition discount to any student that is employed at any of our business partners. So if it's a specific hospital partner, if it's a chamber partner, if you are employed at any of these businesses and you want to take classes at JSU, then you can get a 20% tuition discount as long as you're still employed. So if you're wanting to get that BSN while you're still working, you can do that. You can absolutely do that. You can save 20% while you're doing that. Another part is retention. So making sure that when we get students in, we're keeping them in, that they're not burning out. They're not getting halfway through the program and then stopping out. So we're having to figure out ways to re-engage them. So in that, we're trying to offer specialized support services to students while they're in these classes. So making sure that they have the availability for tutoring if they need it. They have the availability for therapy services if they just need to talk to somebody about something. So these are things that we're really excited about as well. And another thing is availability, in that it has become ever increasing that you don't necessarily have to have, and students are catching on that you don't necessarily have to have a bachelor's degree to have, high paying careers. So that is something that we're looking to be able to offer these students, to say, like, in, creative ways to say, you don't have to have your bachelor's degree, but here are ways that if you want to go beyond the scope of that. So if you want to do your MSN, so if you want to be, more specialized care, move to that nurse practitioner school. We always need nurse practitioners. So we're trying to make sure that we're pushing these options out to students to say, like, if you want to pursue this, the availability is there. The funding can be there. We can help you. And we also, one thing that we're really excited about is we have a new grant program that's called the Pathways to Progress. It's supported by the Alabama Commission on Higher Education and is specifically designed for students that hold an associate's degree but not a bachelor's degree to come back to school, and they can get up to $3,000 a semester grant funded, so they do not have to pay it back. It can be stacked on top of other institutional scholarships. So we're always trying to find innovative ways to make sure the students are supported at every step of the way.
Dr. Simon, cancer care carries unique risks, from high treatment costs to supply chain dependencies. How do you navigate these challenges?
Well, before I talk about those two risks, I think what's unique to cancer care in general as a risk is the toxicity of treatment. Because when you're giving chemotherapy and radiotherapy, these kill cancer cells, but they're also toxic to normal cells. So having a multidisciplinary team in place where on any given day, The radiation oncologist will be there, the medical oncologist will be there. So if there's toxicity from radiation or for chemotherapy, we can bounce ideas off of each other and get the patient the care that they need. Whether it's just a bag of IV fluids, we bring them to the infusion room, give them that. If it's, they're feeling low on energy, we can give them a B12 shot. We have in-house laboratory. So we run a CBC. If you're anemic, we can either, give an infusion or send you to the hospital. And it allows for, screening to make sure that we're minimizing risk to the patient as much as possible. If we see that their white count is low, well, maybe we'll have to put their chemo on hold this week and give them Neupogen to stimulate their white blood cells so that their immune system is going to be strong enough to get care. So I think that that's one big benefit in terms of the risk of cytotoxicity from our treatments. In regards to the treatment costs, we have multidisciplinary tumor boards where we're having the medical and radiation oncologists talk and utilizing the National Comprehensive Care Network guidelines to make sure that we're not having wasteful spending in the healthcare system. Because if I order a test, it needs to change my management. So I'm not just trying to order scans to order scans. So by following these guidelines, we make sure that we're minimizing the cost by using only the screening tests, diagnostic tests, and surveillance tests that we need to treat these patients effectively, which will over time decrease unnecessary healthcare costs. In regards to, financial toxicity for patients, we have our billing department is very transparent. Before you ever start your treatment, they're going to give you an upfront cost estimate to let you know what the total treatment is going to cost you. And we have very, very flexible payment plans that will help patients so that it's not putting undue stress on their families just to cure their cancer, because we can cure your cancer, but if you go bankrupt from your cancer, that's not really helping you long term, because you're still expected to have a long life expectancy and you want that to be as pleasant as possible. We have patient funds available through our Angel Fund that helps offset some of these costs, and in some instances make those treatments free of care, or free completely if you qualify for it. What we have is great in Gadsden is we're one of the centers of excellence in Alabama cancer care system. So we have 10 sites across the state, and we have the newest machine, the most up-to-date linear accelerator that can do the most within our healthcare system. So when you talk about supply chain issues, one of them is the technology at hand. So if I have a patient at my Fort Payne clinic that needs that stereotactic radiation, well, I can send them to our center here in Gadsden, and we can provide relief in the form of gas cards, knowing that they're going to have to drive themselves 40 minutes out of the way every day, which can again offset the cost, because some patients, that's make or break in terms of your treatment. And we have a treatment 40 minutes away that can cure you, but they can't make that drive. So we can cover that cost so that we can make sure that they're getting the proper curative therapy that's going to maximize the best outcome. Then I love that, and that's fantastic. I love that my company offers that. And in regards to medication availability, the fact that we have 10 sites in a centralized pharmacy and we have partnership with a bunch of other specialty pharmacies, it allows for pretty efficient procurement of all of our medications. And let's say that we have a patient next week that needs something in Gadsden, and there's going to be delay on delivery of that. Well, our Jasper or Winfield or Tuscaloosa clinic may have that medication available, and we've got a very dedicated courier that travels between all 10 sites to make sure that no matter what site you're in within our healthcare system, you're able to get the same level of care. And people have touched on telemedicine, but telemedicine is another great thing that we utilize to minimize unnecessary patient visits, because as I said, sometimes the drive and the commute just to get into the clinic is the burden that's preventing the patient from showing up. So something like just going over labs, letting them know that they need to get a scan in 3 months that can be done over the phone, that the patients love that. And there's no substitute for being able to sit on your couch and talk to your doctor instead of having to get ready, get out, and go sit in the waiting room. And another thing that we've implemented is a system called Clara, which is essentially a text message system between our patients and our nursing staff, which allows them to message us directly during the day and get real-time answers. So if something comes up or if there's a question that they have, they send it, it goes directly to our healthcare team that can get back to them in a prompt fashion. So I hope that answers.
Yes. Several of you have mentioned burnout, and John, hospital leadership must balance financial pressures and staff well-being. How is RIPU working to reduce risks such as burnout, workforce shortages while maintaining the highest quality of care?
Before I address that on whoever on Mark's comment about the managed care plans, that's a growing segment of our population. Their patients are moving from traditional Medicare because of the great commercials and everything, all the great promises. But I will assure you, once you get sick, it's a different story. Managed care plans are notorious for denying our claims or downgrading the claims. And it's just a constant battle, and it's becoming more and more, and it really creates some economic impacts for us. But to address your specific questions, hospitals can reduce burnout and improve workforce safety by focusing on proactive strategies and addressing systemic issues. Specifically, at our hospital, we try to focus on workload management, adequate staffing, and flexible work schedules to prevent burnout. From a leadership standpoint, it is our job to create a hospital where we demonstrate empathy. We actually show empathy, concern for staff, well-being through one-on-one checkups and open communication. We create a support culture. We encourage teammates to provide regular feedback and provide clear communication channels for reporting concerns. And then promoting psychological safety. Create an environment where staff feel comfortable sharing their experiences and concerns without fear of judgment for retaliation. To address the burnout, it's managing workload. Implementing strategies to optimize workload, including appropriate staffing, flexible work schedules, and realistic expectations. We can't expect a nurse to effectively treat 7 or 8 patients. Provide the mental health support that's so lacking in this county. Our enhanced training and education. We provide training on stress management, conflict resolution, and self-care techniques. And then finally, our recognizing and rewarding the staff. A good recognition to know that their contributions count, they matter, they impact the outcomes of the patients. To improve the workforce safety, we encourage the staff to speak up. We implement safety protocols, and we invest in technology and prioritize safety culture. Our doors are wide open. We ran on the floors. We hear their concerns and we act on them. I think being consistent in that approach really helps to mitigate that.
All right, thank you. All right, so our next section is going to be a question for all panelists. So if you want to volunteer, go first, or just jump in. We're going to get 2 questions. So the first question I have is, what is the single most important step Etowah County can take in the next 5 years to strengthen healthcare access while driving economic growth? So go ahead.
Again, to keep it local, but also recognize to my right and to my left, you have 2 of your greatest strengths. You have education. By finding people in your community and that want to be in healthcare, training them and keeping them here is your greatest strength. We recognize, again, there is nursing shortages, physician shortages, you name it, there are shortages everywhere. By building a strong pipeline here in Etowah County with Jackson State, with Gadsden, we are building a great system. And that is what I honestly is continuing to support them and then continue to support your local hospitals. And that will build that economic growth and keep healthcare here forever.
I'll go next. The crucial step, like you said, is to invest strategically in healthcare workforce. Through focused education, training, recruitment, retention programs, and improving our technology. Because this multifaceted approach has several direct and indirect economic benefits. It improves the health outcomes and productivity. It creates jobs and economic growth within the healthcare sector, which is just big in this county. Attracting and retaining business. We have to have a robust healthcare system and a healthcare workforce. It reduces cost and eliminates inefficiencies. So I think those are the things that we need to focus on in the next 5 years, really strengthen our healthcare.
I think increasing public awareness of the fact that they can get the same quality of care in the county compared to going to Birmingham is probably the biggest thing. Speaking from Alabama Cancer Care in particular, we've been open since March of last year, and there's plenty of people that don't even know that we exist, let alone that we can offer chemotherapy, radiation therapy, infusions, all of your diagnostic imaging, all under the same roof. So I think making a concerted effort to make the general population feel comfortable that, yeah, you may live in a rural community that's far away from a major academic center, but that doesn't mean that there's a drop-off in the quality of the care that you can get right here in Etowah County.
Anyone else? Okay. All right. Next question and the very last question. So, in your area of expertise, what innovative approach or emerging trend has the greatest potential to improve both the quality of life for these residents and the long-term economic health of the county?
I think the ability to screen by just drawing blood is biggest thing for us, just because just having a simple lab draw when you're getting your CBC and your CMP, checking for circulating tumor DNA in the blood, which can offset the need for CT scans, PET CT scans, which again is the bulk of cost to patients outside of their actual treatments themselves. And then just an increased emphasis on screening for cancer, specifically low-dose CT scans, which have since 2018 have been on the rise because of the changes in the USPSTF recommendations to just get ahead of patients that are high risk of lung cancer, which are those that are age 55 to 80 that have a 20-pack history or more of smoking, that are either still smoke or quit within the last 15 years. These patients are recommended annual low-dose CT screenings, which are oftentimes covered by insurance. And this is going to increase their cure rate from 80 plus 90% if you catch a nodule before it spreads to the lymph nodes to 20 to 30% if it's caught late. So I think just placing an emphasis on, health maintenance, screening tests, it's going to change their life and save their lives and make sure that they live long, healthy lives that die of natural causes instead of neglected cancer.
Absolutely. I think there are several innovative approaches and emerging trends too that we have to take advantage of right here. One is sustainable infrastructure. We really need to design, build, and operate infrastructures like transportation, energy grids, and water systems that are environmentally friendly, socially responsible, and economically viable. What that does is create economic growth, it protects the environment, and enhances the quality of life. Also, a circular economy, a model that aims to close the loop on resources by designing out waste and pollution, keeping products and materials in use, and regenerating natural resources. Once again, that leads to economic health and quality of life for all patients, not just the ones that are living in the hospital. And then finally, the artificial intelligence to improve the efficiency, productivity, and decision-making across various sectors.
Okay. Anyone else?
I actually wanted to step back in because I forgot one emerging trend that we're having in our company, which is, again, I focus so much on cancer care itself, but as I have alluded to before, we offer things that are outside of cancer care. And one of these emerging trends is actually for arthritis, low-dose radiation therapy. So you've got these patients that are dependent on pain medication that, they have high blood pressure and diabetes that are under control, but the things that are bothering them most is their sore knee or their sore shoulder. Well, with just 6 low-dose radiation treatments given twice a week, we have an 80+% response rate to pain with no toxicity of treatment. So that's something that we're rolling out just to, again, try and decrease the dependency on narcotic medications, the need to get injections. So I think that that's going to be a game changer for patients because, heck, we all have achy joints, and the older we get, it just gets worse. I know I'm young, but it's already started for me. So yeah, I think that's a great emerging trend.
One last thing, health information exchanges. The ability, as we see that technology grow and develop, for you to have the ability to go to a physician's office, then to a hospital, then to a cancer center, and for them to all see your medical record. Now, we also recognize there's a lot of privacies and protections that have to be put in place as well, but where a physician is able to see everything and help train and help understand what's going on with your care. When you walk in to an emergency department and we're able to pull up your record and say, oh, look, 10 days ago, you were at your primary care office and this is what the note says that you may have X, Y, and Z. That might be where I need to focus my attention. I think that is one of the emerging trends that we're seeing across healthcare that is going to be absolutely fantastic for our patients and for our residents here in Etowah.
So, that to add to that, at some point, hopefully we can do it across systems. Now, we have that within our system. Now, we have Ethic in the clinics and but only for our Floyd. I don't have it if they came to your ED 10 days ago. And that would be a long way to go to get to that form. Well, that would mean the ultimate goal.
Absolutely.
And we also like it specifically with imaging, because again, radiation oncology, and the bulk of what I do is looking at scans and making sure that we're monitoring the cancer and that there's no progression. So this goes to all healthcare networks, whether it be for Gadsden Regional or Riverview. If there is a scan that there's a read that's strange or maybe the radiologist isn't available, we have PowerShare where you can just send it electronically. I can take a look at it and see if there's anything that needs further workup. My hope is that I look at it and I say, no, this is fine. But the last thing that I want is there to be some question of whether it's benign or malignant and it not get followed up on for 3 or 6 months. And then now it's very obviously malignant where it could have been avoided just from some collaboration. So that's something that at ALCC we're very, very passionate about, is just collaborating with all of the physicians in the area to make sure that they know that we're available whether or not they're our patient at that time, just to make sure the patients in the county are getting the best care possible.
Absolutely. All right, so that concludes our panel discussion. I did want to just mention, we appreciate you 5 gentlemen taking time out of your day to come and inform the community on everything that you're working on. I think it's really important to point out, talk to your friends, your peers, your family members, get them involved in the chamber. Fill this room up next time. This is really important information that we're receiving from just improving the overall quality of life for Etowah County. So it's really important. They're taking their time out of their day. And it all starts a community effort, not just these children here. So thank you for taking the time, informing us all. I think it's been very educational. And we look forward to doing it in this episode. Let's give a round.
Thank you, Kirby, President of Align Tech, for leading this. Thank you all for your participation. Thank you, Align, for being the presenting sponsor, as well as Gadsden State for being the host sponsor, and McDonald's, Etowah County, Cook the Delicious Food. Don't forget, next month we have our Workforce Development Summit. That'll be over at AMC, just across the street. So have a great day, and we'll see you at the next one.
Thank you, Ben.
Mm-hmm.